Okay, hi everyone, I'm Ciara COF, and I'm going to be discussing the effects of euthanasia. How many of you guys have witnessed someone go through pain or suffering, whether it's something as minor as a small cut or an issue as major as a life-threatening sickness? Regardless, pain is something that each one of us have experienced every day. Today I will use my time to persuade each of you to fall in favor of the topic of euthanasia. Also known as assisted suicide, euthanasia is defined as taking a deliberate action with the express intention of ending a life to relieve persistent suffering. Having lost family members to sicknesses in the past, I have witnessed firsthand the toll that these illnesses can take on the body that is being forced through the pain. The current state of health in this country and the prevalence of deadly diseases make this topic more important than ever. According to an article posted by the Thomas Latimer Cancer Foundation, more than 565,000 Americans are expected to die of cancer this year alone, and that adds up to 1,500 people per day. Although cancer is the leading cause of death, this does not take focus from other illnesses that people suffer from every day. I will first discuss the patients in favor of euthanasia, then explain the different methods of euthanasia, and finally I'll end with the overall pros of euthanasia. If someone is struggling and wishes to die, they should have the right to do so. Each person has the right to control his or her own body and life, and perhaps the hands that they also die in. If hearing about the pain that patients experience isn't enough to make you in favor of euthanasia, then possibly the different processes can help sway you. First off, doctors have no duty to kill, so no doctor can be forced into assisting patients in need of euthanasia. The first process is known as active euthanasia, which is the use of legal substances or forces to end the patient's life. Active euthanasia is also known as mercy killing. This is controversial due to religion, morals, ethics, and compassionate arguments surrounding the issue. This is followed with the use of drugs, injections, starvation, and dehydration, as well as gases. The next method is known as the peaceful pill, which is pretty self-explanatory, where the patient is given a pill to take. They pass peacefully with no pain or suffering. Now that I've educated you on the different processes of euthanasia, I'll explain why it should be seen as a positive thing by saving people and allowing this as a way out. This is a method away from pain when quality of life is at an all-time low. It also helps deplete hospital overcrowding, and it improves their quality of life. If we know exactly when we're going to die and knew it was going to be painless, it's a fair bet that fear would be diminished from what we're currently going through. It's also financially beneficial to family members as well as hospitals. Today we talked about euthanasia and the many benefits that can be rewarded out of taking advantage of these processes. Nobody likes to be in pain, and no one likes to witness someone else in pain. In order to literally save a person from undergoing such trauma due to these struggles, my final question is, are you willing to agree that euthanasia is a positive reinforcement? Thank you.
Right, Ciara, the subject is clear. The proposition is not very clear. It sounds like it's kind of a semi-policy claim. You're asking us to favor euthanasia, and I don't really think that fits the classification of the claim of fact that we were talking about. I like your personal story at the beginning to give us a little bit of interest in why we're talking about this, and you've got a nice piece of factual data at the beginning that talks about the frequency with which people have cancer. What is missing here is any information that suggests that people with cancer who who are dying are in pain because they don't get adequate treatment. There's plenty of argument that suggests that pain relief is available. There are plenty of ways to take care of people in these particular situations. I think you need an argument that suggests that those are inadequate, and that's why there is a need for euthanasia as an alternative. There is a little bit of preview for the presentation. The problem is that the way the preview statements are not phrased as declarative sentences, they're mostly just topics, and when you get to each of those points in the speech, that runs, it's almost the same sort of thing. On the first point, for instance, you do say that people should have a right to to decide for this for themselves, which is both a value claim and a policy claim, which you can't use to support a claim of fact. So those are problematic arguments as well. You introduce this idea that there's no duty to kill. That sounds like it's a rebuttal argument to an issue that hasn't been raised yet, and I think that there's a presupposition here that somebody is going to be forced to do something, or they think they're going to be forced to do something if there's a change in the law. I think you need to give us a little bit more context before you give us a refutation of that argument. The problem that I have with a lot of the description that you have here is it sounds like it's an informative speech on end of life and maybe a couple of alternatives to doing it. You say the peaceful pill, and everybody will know what that means. Oh, I'm not exactly sure I know what that means. And why that is effective, why it is safe, why it is appropriate, how it reduces pain and suffering, what the circumstances are under which people would be able to make such a decision. It's not widely discussed. The truth is that California and a number of other states have passed legislation to address this issue, and so we should have some data or some reasons that have been discussed on policy issues about whether or not it works, whether or not it doesn't work, whether there are problems that are associated with it, or whether the problems are all myths. That's, I think, where your argument ought to be. When you kind of drift off onto the value issue about whether or not people have a right to make these decisions, I think that's problematic. When you drift off to the issue about making a policy claim that they should have the ability to do that, that introduces a whole bunch of other questions. On the last point, when you suggest, for instance, that quality of life is the issue that we ought to be looking at, that again, that's a value claim, and there's not any evidence here about why quality of life is more important than life itself. You mentioned hospital overcrowding. In other words, it sounds to me like the peaceful pill is a way to solve Medicaid problems. Let's just get rid of all the people who are sick. I'm not exactly sure that that's the inference that you want us to be drawing. So you want to be careful about that kind of thing. Sometimes you've got a couple of pieces of evidence, but I don't think it's very well distributed among the positions or the topics that you're talking about, and most of it doesn't really help you draw a conclusion. It just gives us factual data. Like I said, the number of cancer deaths every year, you're jumping to inferences that means that all those people are suffering. And look, nobody is happy about having cancer, and plenty of people are going, like you said, they're going to die from cancer, but I don't know that they go untreated when it comes to their pain. That's, I think, the argument that you're suggesting here, and that they, in order to be able to have an alternative to pain, that's why they need to have access to euthanasia. Your presentation is very rushed, lots of reading. That is a little bit of a problem also. You need to speak to us a little bit more personally and build your credibility that way. All right, thank you.